wellness revolution starts now.
Welcome to the show. Did you know that the Hotze Health and Wellness Center has an aesthetics department? Today, we're going to be talking to our amazing licensed esthetician, Bailie Munoz, about SkinPen. And I am just going to start this off with, Bailie, what is a SkinPen?
Oh, okay. SkinPen is a microneedling treatment, and microneedling is essentially a collagen inducting treatment.
All right, so that was a lot of words. What is collagen inducting?
Collagen induction is we are, with the SkinPen, we are creating thousands and thousands of microscopic open channels in the skin and triggering your skin's healing response. And in that, we are tricking your body into creating new collagen, because as we age from our early 20s, as women, we are losing 1% of our collagen every year.
Wow.
Yes.
1% every year?
About 1%. And in menopause, it's up to 30% in a 5-year time frame for losing collagen.
Okay, so
women.
this would be probably really helpful for us older women as we age
helpful,
menopausal.
Yes.
Okay.
Yes, very helpful.
Okay.
Yes.
All right, so tell me more about who else might benefit from a SkinPen. So we have menopausal women. Are there any other people that might benefit from this? I mean, because obviously men, can it help men too?
It can absolutely help men. So if you have skin, you can benefit from a microneedling treatment apart from someone who is experiencing active acne. So if you are experiencing active breakouts, this would not be the best treatment for you. But if you are looking for a treatment to correct signs of aging, fine lines, deeper wrinkles, if you're looking for something to correct scarring, whether it be a surgical scar, acne scarring, post-inflammatory erythema, or hyperpigmentation, we can use microneedling for that. Larger pores, I'm not sure. So men often, their biggest complaint is larger pores, and we can use microneedling very nicely to help to reduce the larger pores, and we can also use it for preventative treatments for someone who's, I'm noticing some laxity in my skin. I want to make sure that I'm, keeping, my jowl area, tight and lifted, or we can zone in on the crow's feet. We can get fairly close to under the eye, and also treat forehead if you're not wanting to have injectables done or Botox. So microneedling essentially can be corrective, preventative, and maintenance.
Wow. Okay.
Yes.
So I want to kind of back up to when we were talking about men.
Okay.
So when I think of men, I think of some of the men that I know that have beards, right?
Okay.
Does that, and you mentioned large pores, and I'm sure a lot of us have, these creases here. Is that something that you're able to work with, or would they have to?
Typically, men will shave within 1 to 2 days of having microneedling done. For the larger pores are usually around, I would say, the classic T-zone area, so the nose, the middle, the glabella area on the forehead. Not usually here.
Okay.
And the neck as well. So with microneedling, we can treat face, neck, and décolleté for all of those signs of aging. And microneedling is a great combination treatment as well. So you can combine microneedling with like BBL, broadband light. You can combine and mix your treatments sometimes with like a VI peel, not necessarily at the same time, but in conjunction with one another. Dermaplaning.
Okay.
And we also use different serums during your microneedling treatment. So we're not just gliding the device across your skin while it's dry. We are creating these tiny open channels. So while we're doing that, we want to place ingredients into the skin that will help with healing, maybe plumping, just depending upon what we're treating, like what your concerns are.
Okay.
So we have different serums that we use topically during your treatment.
So how long does this treatment last? If I came in for a skin peel, or not a skin peel, a skin pen, how long would that treatment last? Like the process
in
itself?
the treatment room? Usually an hour to an hour and a half.
Okay.
This is a treatment that we do numb for. So you'll come in, cleansed skin, we'll do your Visia for your treatment progress or before and after photos. Cleanse the skin. I will apply topical numbing. The microneedling treatment in itself is minimal discomfort. So you won't feel much on the skin. It can feel maybe a scratchy, but nothing uncomfortable. Okay. The numbing wears off after your treatment. And with SkinPen, there's minimal downtime. I would say 2 to 3 days max from start to finish treatment to healing time.
And is it a cumulative effect, or would I need to do so many skin pens before I really start to see an improvement?
Both. So depending upon your skin and what your concerns are and what your goals are, will really determine how many treatments I would suggest starting with and how often. Usually you're coming in for a microneedling treatment once a month. I would generally say 3 to 5 treatments if we are corrective. And if you are on a maintenance, maybe you could come in quarterly for your treatment. And you're not in the office long. The downtime is very minimal. The discomfort's minimal. But the results, so your skin is healing up to a month's time frame after your treatment. So you're gradually noticing results and change within your skin. And that could be anything from, collagen, tightening, minimizing the appearance of scars, and cell turnover as well. So we are also enhancing cell turnover.
And would you have for that month that it's repairing, would you have a skin regimen for me to incorporate? Like, would there be certain lotions or creams or serums that I would need to put on?
Always have a skincare routine in place for post-treatment just to ensure proper healing. We want to make sure that your barrier is intact and well taken care of, and that you're avoiding using certain ingredients. I would say 2 to 4 weeks prior and maybe 2 weeks after your microneedling treatment.
Okay.
So I always recommend certain products for post-care usage, and of course sunscreen.
Always sunscreen.
No sunscreen, no treatment.
I'm gonna segue real quick because you mentioned something about a Visia. What?
Visia.
A Visia.
Oh, okay.
What is a Visia?
Visia is a 2-dimensional skin analysis. So essentially it's a photo that we're taking of your face at different angles. So we have forward facing and right and left facing photographs. It's for you and I to see only, and it shows us more in depth what's going on in the skin. After your consultation, after we've come up with a treatment plan that's best for you, when you come in for your treatment is when we do the Visia. And each time you come in for a treatment, we will take the Visia photos so that we can have progressive visuals throughout your treatment plan. And it's a great before and after. The lighting is consistent. It shows us UV damage and brown spots that have yet to even surface. It also shows us, it measures your pore size, so it counts your pores. It will show us if we are reducing pore size. It will almost count the fine lines and the wrinkles, so it will give you a visual, which we either love or hate. And we can look at the reduction of that over time and inflammation. So we can look at redness and inflammation that we usually will not see just by looking at each other face to face. If it is rosacea, we can that is visible. Okay. But the inflammation that is caused within our skin from environmental factors or the computer screens and cell phones and things that we don't think about, when that inflammation is triggered within our skin, that's when we start to see all of these aging signs.
And so, that's when we come to Bailie for a skin pen.
That's yes.
All right. So if I got my Vizia and I was
Okay.
like, oh gosh, I need to schedule a SkinPen. How do I do that? Who do I call, or how do I reach you?
You can reach me directly. You can call me directly at my office or email me, as a matter of fact. Any inquiry that's filled out online for aesthetics will come directly to me. So my office is 281-698-8770, or email, fill out the inquiry online, and I will be the one personally reaching back out to you to help with setting up appointments or answering. I can answer most questions over the phone. However, I do count on that in-person, face-to-face consultation visit so that I can see and really give an accurate recommendation for what treatment would be best.
Brilliant.
Yeah.
Thank you, Bailie.
Thank you, Jill.
All right. So just to repeat that number to reach Bailie, it's 281-698-8770. Or she also mentioned a form that you may fill out online if you go to hotzebeauty.com. Thank you so much, Bailie.
My pleasure.
Thank you for joining our show.
At Physicians Preference Pharmacy, we believe that prescription drugs are commonly overprescribed, treating symptoms only rather than addressing the underlying condition. These drugs offer a temporary fix, but they don't solve the root cause of the problem. Our approach is not about overloading people with medications that offer only a temporary fix. It is so important to recognize that you do not get sick because you have a low level of pharmaceutical drugs in your blood. You get sick because you are deficient in something or because your body is not in balance. As part of your healthcare team, we work with your doctor to restore that healthy balance. Sometimes this means replacing hormones, vitamins, nutrients, or even antioxidants. So how is this different than traditional treatment? Rather than covering up the symptoms with yet another medication, we work to replenish the body, restoring your health and restoring your wellness.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.